सर ये क्या केस था और what has been the outcome and how has the patient been doing?
The patient had a hole in the heart, which is a type of atrial septal defect. This is not a common atrial septal defect. This was a sinus venosus atrial septal defect, which means it was in the upper chamber, and this had got no rims at all. Normally, this patient would have been done in open heart surgery, but this is among the first few cases in the world which has been operated without open heart surgery, without the need of general anesthesia, without any scars, without any stitches, and this was done with an interventional approach via the vein in the groin, in the leg, and one vein in the neck upstairs. In entire India, only 1 or 2 cases have been done in Chennai. Otherwise, this is the first case in the entire North India which we've done here, and we take pride in doing it. I thank Dr. Deepak and the entire team, and Dr. Ankur, who's there with us, the entire team who spearheaded this revolution, and hopefully we should be able to deliver much more.
How has the patient been performing all this while, and when did you came to know that how complicated the problem of the patient was?
The time when the patient presented to us in the OPD, there and then we suspected that this patient might be having a hole in the heart. Immediately we went ahead and did the echocardiography of the patient. We even did a transesophageal echocardiography to plan up the procedure for this patient and to see whether this procedure can be successfully, without any much complication, can be performed in this patient or not. So we did a transesophageal echocardiography. There and then we came to know that the patient is having sinus venosus ASD defect, and till date, as Dr. Amit said, that the only option was surgical treatment for these patients. So we discussed together regarding whether we can plan this patient and do a non-surgical on beating heart intervention and close this hole using the stent. Then we both were on the same page. We had detailed literature discussion also. Then we went ahead and did the procedure, and we staged this procedure just because, as Dr. Amit told, this is rarely done thing. We are the few centers across the globe who is doing this procedure. So we staged the procedure in a way that first we admitted the patient, made up all the plan and all the hardwares we need during the day of the procedure. So we did a detailed CT scan of the patient. The cardiac cath study was done to see with the balloon whether we are not occluding any normal vein or we are redirecting the blood into the normal chamber. All those things were studied in detail. Followed by that only we readmitted the patient to do this procedure completely. And I thank Dr. Amit that sir had the belief in us that we can do this procedure, and has been there with our backing and stood by me on the table to guide in this procedure and do it successfully. The patient is doing fantastically well. It's 4-week post follow-up. Today also we did an echocardiography. So the stent looked fantastic. It's in position. The flow is perfect. No vessel is blocked. The hole is completely closed. Even the heart size, to our surprise, has come back to normal at a very early stage. So the heart had the reserve.
You said that you have operated and now he is free of the problem forever. And at the same time, he only needs some medicine, and at the same time that will also gradually wind up.
So these are holes. When you close it, it is like fill it, shut it, forget it, once for life. No medicine is required beyond a period of 3 months. Again, early detection is the key. Had we diagnosed the disease in time and we treat in time, the patient goes home happy. So many times, early detection, we do not think that every shortness of breath is not asthma, every acidity gastritis is not acidity gastritis, it is cardiac. So please, the message is very, very loud and clear. Childhood screening is a must. Echocardiography for patients who are symptomatic is very, very important. A simple tool like an echocardiography can diagnose where is the hole, and then to delineate whether we can do the hole without open heart surgery, we use modalities like a transesophageal echo, which is an echocardiography done through the mouth, or a specialized CT scan to diagnose whether these can be closed. So end result was fabulous. It is all an effort of team planning, but early detection is the key, and the patient has to come out of the denial mode that I am not having acidity, I am not having gas, I am not having asthma, because these diseases will not be fatal. Cardiac diseases can definitely take your life.
How did you prepare it and prepare your patient to get into the operation table or procedure when it was happening, and at the same time when his procedure was done, how did you get the patient active once again now that he is walking and he is able to move around as normal?
When the patient got admitted actually, so he was very fine only. So the vitals were very stable. So we have to look for all the whatever the complication which patient may have. We have to look for the critical part which may patient have, or which patient may have post-operatively. So we have to look all the things like fluid management from the antibiotic and from the post-operative, like rate control, heart rate control, and blood pressure control. So we have to look for all the things which are post-operative.
I assume, sir.
Think that he was without general anesthesia, under conscious sedation, thanks to the entire team that we did it, without anesthesia, without an open heart surgery, without any stitch. It was only a stick in the groin and one stick in the neck, which was both taken out, and the patient was ambulatory in 12 hours. 12 hours he was walking. If you ask somebody that you've done a surgery and he's walking in 12 hours and going home in 24 hours, it is nothing short of a miracle.
So this could be a procedure that could be utilized in further these kind of operations, and more complicated than this, because now that you have specialized this treatment.
Going to define the quality of healthcare. This is going to revolutionize how we deal with holes in the heart. With Deepak in tow, mark my word, this is going to be a revolution in the country for years to come. He's been doing, now we've got calls from other parts of the country to do such cases, and hopefully we should be able to deliver at a much cheaper rate in future.
Thank you.